Hello, everyone. I'm May Ng, and I'm pleased on behalf of my co-authors to present to you Improving Type 1 Diabetes Care in Southeast Asia through Government Partnership Working with Action4Diabetes. I have no conflict of interest disclosed. In the background, there is minimal data of health outcomes for type 1 diabetes care in Southeast Asia, where government funding for insulin or blood glucose monitoring either does not exist or is limited. Action4Diabetes is a UK-registered non-government organization charity formed in 2016 that currently provides type 1 diabetes healthcare in 5 low-middle income countries, namely Laos, Malaysia, Vietnam, Cambodia, and Myanmar. The objective of our study was to review the current type 1 diabetes provisions, the type 1 diabetes management within these 5 Southeast Asian countries, and to determine the glycemic outcomes between 2020 and 2021. In our methods, we reviewed the current country's healthcare coverage, its multidisciplinary team support, the diabetes management practices, DKA rates at diagnosis, and the mean HbA1c between 2020 and 2021. We included 383 children and young people with a mean age of 14.7 years who represented the number of patients supported by the Action4Diabetes programs within Southeast Asian countries. The mean HbA1c between 2020 and 2021 are summarized in this table, with an average mean HbA1c of 9.7% across the 5 countries. This table represents the diabetes multidisciplinary management practices and DKA rates at diagnosis. We can see that the DKA rates at diagnosis varies considerably, but are generally high at approximately 70% apart from Vietnam. We conclude that this is the first reported paper on type 1 diabetes management practices within healthcare systems and glycemic outcomes for the 5 Southeast Asian countries. Variations are noted in the multidisciplinary team support, as well as diabetes management practices, and high DKA rates at diagnosis were also reported apart from Vietnam. Average glycemic index were noted to be at 9.7% between 2020 and 2021. Health systems in low-middle income countries lack universality, and in Southeast Asian countries described where healthcare coverage for diabetes, such as access to insulin and blood glucose monitoring kits, are limited, type 1 diabetes care gaps will continue to exist between developed countries and resource-limited countries. We show that government partnership working with non-government organizations to support children and young people with type 1 diabetes are the first steps to closing the type 1 diabetes gaps. Thank you.